Hi, my name is Dr. Kyle Cassas with the Steadman Hawkins Clinic of the Carolinas. I have the privilege of serving as medical director for Acceleration Sports Institute here at our Patewood campus. What my responsibilities entail really are looking at the programs that are in place, and the big things we want to try to look at are safety and injury prevention as it relates to the programs that the trainers put the clients through. The athletes that train really at ASI can be anybody. We truly focus really more on the high school athletes and above, but really can be from weekend warriors to folks in the community that are just trying to get quicker and faster. So I think it's really limitless. I think if you're interested in it, come take a look and give it a try. The things that make ASI different really are not only the speed flex component, which is really looking at all the major muscle groups. You're looking at power, flexibility, and quickness. And so speed flex is the unique part of it. And then they also do functional training with all the major muscle groups, functional movement, which is important for today's athlete, and really just to try to make you the best athlete that you can be. The other unique component about ASI really are their trainers. They have some of the highest training anywhere around. Relates to kind of their sports certification, injury prevention, and really from a nutritional standpoint. So we're really lucky to have that in place. And as a medical director, that lets me rest a little bit better, knowing that the guys that are training these folks are the top level with the most experience and the highest level of training. For the patients that come in the office, oftentimes we'll talk about ASI, and these will be athletes that have had an injury. They're looking to get back to their sport, and so they'll go through physical therapy and go through that process, which will take, let's say, 6 weeks or so. And then after that, they need a way to kind of get back to that level again. And oftentimes we use ASI as a bridge from pro-axis to getting back to competition. And so they'll take them through sport-specific drills, look at areas that the physical therapist has already worked on, and try to get them stronger, working on core, working on flexibility, and then obviously strength. I got started with ASI, or interested in ASI, as a client, working out there, getting a chance to see the equipment and see the facilities, and realizing pretty quickly that this was a much more efficient way for me to exercise, get stronger, and utilize my time the best I could, and really reduce my risk of injury. And so that's really how I got interested in it. At ASI, the unique thing there for the client is that we're supervising all those programs. And so if there's something that's happening with one of their clients, meaning they're having an issue with shoulder soreness or something bothering them, I'll typically see those athletes in the office the same day, or if there's a situation arises. And so it's easy for me. I can either come over there and see the athlete, or we'll come right over to the office and assess them and make sure they're safe to continue to train. One of the unique things about ASI is their efforts as relates to sports medicine research. And so we've got some programs in place now. We're looking at both Parkinson's patients as well as traumatic brain injury, and looking at kind of exercise as medicine and how these patients do, both functioning with their regular day-to-day activity and also in life and at home. And so very excited about that component of ASI. The other interesting thing about ASI is the clients that go there are folks that are really looking for a unique experience. And so the thing I like is that you're outside, it's fast-paced, you're not stuck in a gym indoors, and they utilize both some outside training, some sand training, and then the speed flex machines inside. And so really you can't find any mix of that anywhere else here in the upstate.